Hi everyone, I'm Donna Hamilton. Say Baltimore and what springs to mind? Crab cakes, Cal Ripken, Fort McHenry, but don't forget Mercy Medical Center. Mercy anchors Baltimore's downtown business district and is known for delivering academic hospital caliber care in a community setting. Investing in a Gallup study and dispatching a team to visit women's centers all across the country, Mercy has become one of the first hospitals in the United States to focus its mission on the care of women. Medical advances that once seemed like science fiction are now fact. Standing at the forefront of one of these advances is gynecologic oncologist Dr. Dwight M., medical director of the National Robotic Institute at Mercy. He has performed more than 5,000 robotic surgeries in the past decade. Still, Dr. M seems to be less a man of the push-button age and more of the age of enlightenment. Teacher, healer, and artist of medicine, Dr. M never stops learning and always to his patients' benefit.
I came here 24 years ago. I certainly hope that we did make a huge difference in health for women. And I think Mercy put that on the map and it finally became a phenomenon. People talk about women's health. Half the population were ignored thousands and thousands of years.
Right, absolutely. What was it that persuaded you to come here and be a part of this?
It was almost like, like love at first sight. It really was.
Really?
And I said, wow, this place is amazing. People come here specifically seeking treatment that other places do not offer. And to be a part of that it's huge.
I've read that you're somebody who doesn't take vacations.
I have this passion for treating women, right? Because I feel like I was put on this planet for a reason, and that's to help women live longer, but with quality of life. When I call patients like at 8 o'clock on Sunday night, they're like, why are you calling me?
I'm sure they must be shocked.
They're shocked. They're pleasantly surprised.
And you want to know how they're doing.
Right. I give out my cell phone numbers too. When you are having problems after surgery, it doesn't have to be a long conversation, but just the thought that I'm just one phone call away. A lot of them, it means a lot to them.
Yeah, and you can answer that question.
They've done more for me than I could have possibly done for them.
In what way?
They taught me how to be a good listener. Just listen.
Everyone needs someone to listen to them.
I think the days of I'm the doctor, you're the patient, you have to do what I tell you, they are gone or they should be gone. It's a team effort. I always try to remember something about my patients that come back. I will look at the list of my patients for the next day. One by one, I'll think, okay, Donna Hamilton, she just retired. I wonder what she's up to. I wonder how her kids are doing.
You're a great listener, but I know really one of your fortes also is the operating room.
What I typically do is like the night before the surgery, I'll look at all the list of surgeries for the next day, and I am actually performing each surgery in my head.
Really?
The night before. I'm going to start here, go there, and I could anticipate problems because of our history and so on.
Right. So you visualize the whole
Visualize
thing.
the whole thing. I do about 1,200 a year, so it's a lot of cases.
How do you do that?
It's all about efficiency, knowing exactly what to do. Plus, I rehearse. Remember my surgery?
That's right. You visualize
I
it.
visualize. That's the only way you can do it.
Finely tuned.
Every single step is exactly the same, so everybody in the room, my staff, knows where I am and what my next step is.
And what you need.
Exactly. I used to do in the beginning of robotic surgery, I would record all my cases, and guess what I did on weekends? Go back and review. So it's a combination of not only rehearsing, like preview, but review.
You are so serious about what you do. You love what you do. But I know there was a time in your life when you were not quite so, you were a little more kick back, let loose.
John Travolta was my idol. David Cassidy, actually, Partridge Family, so.
You even had a nickname, didn't you?
I had Disco Dwight, Double D.
Disco Dwight. What do you think the real challenge is for healthcare, for Mercy?
I think it has to do with not only having, medical care accessible and affordable, but can we make it pretty much the same quality of care throughout the whole country? That's what I would like to see. But in some states in the country, there's not a single gynecologic oncologist in the whole state.
Here at Mercy, you also do training.
I really want to focus on training a generation of surgeons who can continue the legacy that Mercy has built over the last 25 years in women's health.
I think you're probably the person to do that. I know you mentioned when Neil Rosenshine, what introduced you to him was you were in a surgery and something happened in the operating room.
Sure. So this one, professor was operating one day, again, telling everybody how great he is, right? I'm God's gift to mankind, and he's operating on this patient, and suddenly he hit a vessel, and he begins to panic. All that arrogance is no longer there. So Neil Rosenshine happens to be operating next door. So he, within 30 seconds, it's over.
Fixed it.
So I'm standing 10 feet away as an intern, and I'm like, I want to be that guy.
I want to be that guy.
That's the biggest decision I made in a career move. I mean, I've never deciding to go into gynecologic oncology and also decided to come to Mercy. You know how we all come at crossroads and like, do I go this way, that way, and then all the consequences. So I've made two pretty smart moves in my life, and
I would say
it turned
so.
out okay. Not a day goes by where I don't really appreciate, or think about the decisions I made.
Few in medicine today would argue the importance of women's health care, but that was not always the case. Mercy Medical Center was one of the first hospitals in the nation to recognize the need for a program dedicated to women's health. Armed with a vision, Mercy doctors and administrators joined with the Sisters of Mercy to create a center specifically designed for the diagnosis and treatment of women's disease, from breast and ovarian cancer to all manner of GYN conditions. Today, the Weinberg Center for Women's Health and Medicine at Mercy is recognized as among the best, providing quality care in a compassionate setting. I hope you've enjoyed this opportunity to become better acquainted with Mercy and its mission of caring, as seen in the physicians who have made this mission their own.